I'm Robin Castleman, and I'm here today with Dr. Whitney Cope, and she's with the Audiology and Hearing Center. And we're going to field some of the questions you guys have called in with. You ready to get started?
I am.
All right. So our first caller says, I had a viral sinus infection and now have lost hearing in one ear. Is it possible that I will regain my hearing?
So that's kind of a diverse question. Anytime you have a sudden shift in hearing, you definitely want to address it. Any sudden anything, but even if it's associated with a sinus infection, you may wait until you're finished with medications or anything that you're on, because sometimes it can clear up with time with that. But I would definitely recommend getting a check on it pretty quick if it does not improve when you are taking steroids, antibiotics, whatever.
Gotcha. Okay, the next question says, my husband uses earbuds all day for his job. Can excessive use of earbuds damage your hearing?
Also a good question. I get that question a lot. So it kind of depends on the level and the environment that you're wearing it at. So obviously if you're in a louder environment, you're going to tend to turn it up louder, so I generally recommend having some kind of noise canceling earbuds or headphones. If you kind of have it at a moderate level, it's generally okay. So it just kind of depends, but anytime you have it turned up to an elevated level for an extended period of time, it can definitely cause damage.
Gotcha. That's good to keep a mindset on.
Right, especially nowadays, so many headphones.
Yes. Okay, so this person says, since allergy season has started, I feel a lot of pressure in my left ear, and I'm noticing that I can't hear as well in that ear. Do I need to seek treatment, or will it heal itself?
I'm gonna kind of say the same thing as I said with the beginning one. I would definitely, the quicker you act on anything, the better the outcome. So I would tend to say I would get it addressed. It could just be simply putting you on a nasal spray or an allergy pill or something like that, but you definitely don't want to let it get to the point where it is a permanent situation. So I always like to err on the side of caution and have it addressed early.
Gotcha. And I feel their pain because I can have chapped lips and I've got an earache, so I get it.
Right.
I totally get that. All right, our next person says, my dad's hearing aids are 6 years old and he seems to not be hearing as well. How often do they need to be replaced?
We generally say the average life of hearing aids is about 5 years. So, I mean, he is a little past that. There are a lot of factors to take into consideration, but there have definitely been significant improvements in the technology in that period of time. So it's definitely something to consider. I would definitely recommend following up with your provider, having an updated hearing test, and kind of seeing what the options are at that point.
Great strides have been made in these.
It's insane,
yes,
the changes that they make. I mean, think about any technology, cell phones, TVs in the past 6 years, you know, ton of improvements. So
I'm amazed at them, to be honest. Well, thank you so much for answering our questions. We appreciate you.
Thank you.
Thank you. If you would like to revisit this segment of Health Experts, log on to WPSDLocal6.com and click Health Expert. Up next, Jen Heine from Lindsay Funeral Home is going to be here with me, and we're going to talk about pre-planning. That's after this on WPSD Local 6 Midday.
Pronamel, clinical enamel.